Welcome to the Deep Dive. Today we're digging into something truly massive, a huge effort tackling, well, one of the world's oldest health challenges. We're talking about India's really ambitious 100 Days campaign against tuberculosis. Our source today is a pretty comprehensive document outlining this whole national campaign, so our mission really is to unpack the strategies, the incredible number of people involved, and big goals behind this very intense push for a TB-free India.
Yeah, and it's a colossal undertaking, you're right. India has a huge share of the global TB burden, actually the highest number of cases worldwide. So a big national push like this one, it's not just important, it's absolutely critical. We need measurable progress against a disease that, affects millions and has really devastating social and economic costs.
Okay, let's unpack this then. What exactly is tuberculosis and why is it such a major health focus in India?
So tuberculosis, or TB, it's an infectious disease caused by a bacterium, Mycobacterium tuberculosis. It mainly spreads through the air, respiratory droplets. So when someone infected coughs or sneezes, tiny droplets with the bacteria get inhaled by others. And what's really concerning is an infected person has about a 10-15% lifetime risk of developing active TB. And if they're untreated, a single patient can infect 10, maybe more people in just 1 year, which makes it incredibly hard to control without aggressive action.
That really paints a picture of the threat level. So to tackle this, India set up the National TB Elimination Programme, or NTEP. And this isn't just any program, right? It's a centrally sponsored scheme under the National Health Mission umbrella. So the central government provides a lot of the funding and strategy, but the states handle the vital on-the-ground work. The big vision, of course, is TB-free India, offering free diagnosis and quality treatment for everyone.
Exactly. And the NTEP goals are ambitious, very ambitious. They're aiming for an 80% drop in the annual TB incidence rate and a 90% drop in TB deaths compared to 2015 levels. Plus, they want zero catastrophic health spending because of TB, which fits right in with the UN Sustainable Development Goals. And they have made progress. As of 2023, incidence was down 18% from 237 cases to under 95 per lakh population, that's per 100,000 people, and mortality down 22% from 28 deaths to 22 per lakh. So real progress.
Okay, so they have a solid plan and they're seeing results. What have been the main parts of the NTT strategy so far?
Well, the key activities really revolve around early diagnoses using good tests and getting out into the community. Also, prompt treatment with quality drugs. That includes drug-resistant TB. They've worked on engaging the private sector, which is important, and there's the Ni-kshay and Mitra initiative. We can talk more about that. Plus, contact tracing, preventive treatment, controlling airborne infection, and a multi-sector approach looking at things like poverty and nutrition.
Right. So comprehensive program, definite progress. But clearly, something wasn't quite enough or moving fast enough to need this new focus campaign. What are the stubborn challenges?
That's the key question, isn't it? Several big challenges persist. First, COVID-19 hit hard. Restricted movement, limited access to diagnosis, treatment. It set things back. Second, TB testing rates are still, lower than ideal. Over 70% diagnosed by basic sputum smear tests. That means we're underusing better, faster methods. Third, health-seeking behavior is poor. Stigma is a massive factor. A 2022 survey found something quite alarming. Almost 60% of people with TB symptoms just didn't seek help.
60%, wow.
Yeah. Then fourth, undernutrition. It's a huge driver for TB infection turning into active disease. Affects almost half of all TB cases. And finally, mortality is still high because of things like drug resistance, low BMI, other health issues like diabetes, and crucially, delays in diagnosis. These are the gaps this new campaign really aims to plug.
And that leads us right to the 100 Days campaign. It sounds like a really focused, intensified effort to tackle those exact challenges and, speed things up.
Precisely. It has three core goals, like a targeted strike. First, ramp up screening and testing, especially for vulnerable groups. Second, significantly boost nutritional support. And third, prevent new cases by giving preventive treatment to household contacts, people with HIV, and other vulnerable populations. It's all about a concentrated, time-bound push to make a real difference.
So a targeted offensive.
Yeah.
Where does it focus? How do they pick the areas needing this intense effort?
It's quite specific, based on clear data. They prioritize districts with high death rates, like 3.6% or more, or high incidence, say 200 cases per lakh or higher, or high TB prevalence, over 400 per lakh. This process identified nearly 350 high-priority districts across 33 states and union territories. And importantly, this includes a real focus on vulnerable areas, tribal communities, mining regions, the designated aspirational districts, places where the burden's high and care can be harder to access.
That's impressive, drilling down like that. So once they've identified these districts, How do they actually plan to reduce both new cases and deaths? What are the key strategies?
Right. So to cut down incidence new cases, the focus is on mapping vulnerable populations first, then running proactive screening and testing campaigns. They call them Ni-kshay. And they're using high-sensitivity tools X-ray and NATE. That's the nucleic acid amplification test, a fast, very accurate molecular test. There's a big three-pronged screening approach. They aim for a 100% screening of specifically listed vulnerable individuals, then 100% of people attending special clinics, HIV, diabetes, cancer, dialysis, tobacco cessation clinics, and then a wider net, screening at least 10% of adult outpatients in bigger hospitals and health centers, and 5% in the smaller primary health centers. Now, to reduce deaths, the strategy is about early diagnosis, getting the right treatment quickly, and really assessing people for how severe their TB is and for other health problems, things like diabetes, HIV, cancer, chronic heart, kidney, liver disease. These high-risk patients get prioritized care, maybe even hospital admission if needed. Timely intervention is key.
Makes sense. And you mentioned nutrition earlier.
Yes, absolutely critical. Nutritional support is a huge pillar here. There's the Ni-kshay Poshan Yojana, or NPY. That gives a monthly payment, Rs-1000, for food during treatment. And the Ni-kshay Mitra initiative, which we touched on, extends support to household contexts too, recognizing the whole family is affected. Plus, there's a new policy. Patients with a low body mass index, 18.5, so clearly undernourished, get 2 months of extra energy-dense nutritional supplements. That's vital for recovery.
It really sounds holistic, tackling the infection and the surrounding issues. So, timing. When is all this happening?
Okay, the 100 Days campaign officially kicks off on December 7th, 2024. The main intensive activities, the Ni-kshay camps and all that, run from December 8th right through to March 17th, 2025. And it all culminates, quite fittingly, on March 24th, 2025, which is World TB Day. But before the launch, there's a lot of prep work happening now. Sensitizing states, mapping resources, grassroots training, detailed microplanning right down to the village level.
So what do they actually expect to achieve in these 100 days? What are the tangible outcomes?
They have very clear targets. Expected outputs designed for rapid impact. First, detect an extra 2 lakh TB cases, people who might otherwise be missed.
2 lakh additional cases. Okay.
Yeah. Then achieve at least 90% screening coverage with X-ray for those identified vulnerable groups. And 90% testing using NATE. This is a massive jump in using the best diagnostic tools. They want to boost upfront NATE use from just 30% now to 70%. Much faster diagnosis, faster treatment.
Huge difference.
Definitely. And finally, ensure 100% coverage by both the Ni-kshay Poshan Yojana, the cash support, and the Ni-kshay Mitra initiatives, the community support. Full wraparound care.
Now, you mentioned Ni-kshay Mitra, and there's this term, Janbhagidari, community participation for TB Mukht, the TB-free India. This seems like a really crucial part of it all, the community getting actively involved.
Yes, Janbhagidari is absolutely central. It's about making this a people's movement. The goals are, well, raising awareness about TB symptoms, getting people tested early. Right. Also, crucially, reducing the stigma that still surrounds TB, encouraging people to complete their treatment, supporting them with nutrition through the community, and promoting prevention too. Cough hygiene, good nutrition, ventilation, preventive treatment. To make this work, you genuinely need everyone involved. Government, non-government, a real whole-of-society effort.
But how do you actually mobilize such a diverse group? I mean, from members of parliament down to, say, postal workers. That coordination sounds immense.
It is immense, but the plan is very comprehensive, layered. Take elected representatives, MPs, MLAs. They're encouraged not just to show up at the Ni-kshay camps, but to actively speak out, use their influence to reduce stigma. Take the Ni-kshay Shapath. It's a public pledge with the community. They're asked to help find more Ni-kshay Mitras to adopt patients, distribute food baskets. They can even allocate funds for X-ray machines or NATE machines, really leverage their position. Then you have local government bodies, Panchayati Raj institutions in rural areas, urban local bodies in cities. They're driving the TB-free Panchayat initiative. Planning activities at the village level, finding local resources, getting self-help groups involved, creating awareness through village meetings, wall paintings.
Because it goes right down to the grassroots level.
Absolutely. And youth involvement is another big part. Getting students, school health ambassadors involved, forming youth brigades for awareness, things like art competitions, training teachers, linking TB messages to events like National Youth Day, using volunteers from NSS, NCC, Red Ribbon Clubs for outreach. And then there's this incredible whole-of-government push, especially during Ni-kshay Sapta, a dedicated week in late January, Feb. This is where you really see the Jan and Dole and the people's movement in action. Some examples are quite striking. The Ministry of Culture. illuminating monuments on the 24th of each month, that's Ni-kshay, using art festivals for awareness.
Wow.
The Ministry of Railways, screening camps at stations, messages on trains, maybe even on tickets, public announcements. The Department of Post's messages on postcards, packaging, telecommunication, anti-TB ringtones, push messages. Ministries like coal, mines, heavy industries organizing screening camps for workers in mines, factories, public sector units. Labor and employment doing the same via e-seek hospitals, getting trade unions involved. It's everywhere.
That's embedding it into daily life, isn't it? Using almost every government touchpoint. Truly ingenious.
Exactly. And it goes beyond government, too. Industries, corporates, businesses, trade unions, they're asked to run screening camps for workers.
Yeah.
To become Ni-kshay Mitras themselves, provide nutritional support, implement TB-free workplace policies. Even banks are roped in opening zero balance accounts for patients, becoming Mitras. And that Ni-kshay Mitra initiative itself, it's the flagship for this community participation. It formalizes how individuals, NGOs, companies, anyone can adopt TB patients and families. Providing nutritional support, yes, but also help with tests, maybe even vocational support to get back on their feet. They'll have registration desks at the camps to sign up new Mitras, link every patient with support, and recognize the existing Mitras too. It builds that sense of community ownership.
What really stands out here is just how detailed the operational plan is. Getting down to the village level, making sure all these different parts, government, community, industry, work together. It's clearly not just a top-down directive.
No, it's incredibly detailed. Look at Information, Education, and Communication IEC. Clear goals. Raise awareness, cut stigma, promote screening, preventive treatment, treatment completion, nutrition. They know their audience. High-risk rural groups, people in vulnerable settings like orphanages, slums, migrant sites, but also healthcare providers, local leaders, teachers, students. The messages are simple, direct. TB is curable. Know the symptoms: cough, fever, night sweats, but also maybe neck swelling for non-lung TB. Cough etiquette, ventilation, seek early, free treatment. And they use everything. Radio jingles, loudspeaker vans, village health workers, street plays, puppet shows, posters, wall paintings, school campaigns, a real mix. Then there are the Ni-kshay Vahan, the mobile medical units. Around 1,000 of these, already part of the National Health Mission, are being used. They're basically mobile clinics. They do awareness, run camps, get staff to remote areas, and find cases in places like prisons, orphanages. They have staff, portable x-rays, and even TrueNut machines for rapid on-site molecular testing, bringing diagnostics right to the people.
Mobile testing, that's key for access.
Absolutely. Then the field activities, let's break it down. Screening. At the community level, focusing on those high-risk groups: older adults, malnourished, diabetics, HIV-positive, smokers, alcoholics, contacts, past TB patients. Symptom checks and x-rays every 6 months done close to home via the Ayushman Arogya Mandirs, those wellness centers. At health facilities, screening 5% of outpatients in smaller centers, 100% in the special clinics we mentioned, plus inpatients, immunocompromised people, and reaching out to private clinics, pharmacies, AYUS providers too, testing. Bringing it closer with mobile units, X-ray, and NATE. NATE is the go-to method now for diagnosis. Faster, more accurate. Logistics are planned out: how to collect sputum and other samples, transport them from the local centers to the NAT labs, including free transport or reimbursement so cost isn't a barrier. Notification, making sure every diagnosed case gets reported from public and private facilities. Supervisory visits to catch missed cases, using support agencies, PPSAs, to help private doctors report promptly. Post-diagnosis support, it's comprehensive. Checking for drug resistance, HIV, diabetes right away. Assessing nutrition, overall health, TB severity. Prioritizing care, hospitalizing if needed. Ensuring people stick to treatment, managing side effects involving family and community supporters.
And the nutrition part again.
Yes, boosting existing schemes. The Ni-kshay Poshan Yojana that Rs 1,000 a month goes directly into bank accounts via DBT, much smoother. The new policy gives those extra supplements for 2 months to patients with a low BMI, 18. And the Pradhan Mantri TB Mukt Bharat Abhiyan, the broader support initiative, now covers all household contacts, not just the patient. Prevention for the whole family. And finally, preventive treatment, TPT. Finding household contacts of lung TB patients, screening them with symptoms, X-ray, testing for infection. Then, starting TPT, monitoring it, providing counseling and drugs right there at the local Ayushman Arogya Mandir centers, making it easy to access. The operationalization and monitoring side is intense, micro-planning down to the village, mobilizing all the staff, health workers, volunteers, lab techs with proper training, sorting out logistics, getting enough X-ray and NET facilities ready, including mobile ones, maybe even buying services from private labs if needed. Specimen transport has to work seamlessly. And then,
rigorous supervision, daily data checks through the Ni-kshay digital platform, reviews after the campaign, a dedicated budget. They'll even give awards to top-performing states and districts.
Wow, incentivizing success.
Exactly. It shows that whole of government, whole of society approach again. From the ASHA worker identifying risks in her village, up through supervisors, district officers, right to the district collector and state principal secretaries overseeing it all.
This 100 Days campaign against TB, it's truly a monumental effort, isn't it? So comprehensive, driven by the community, meticulously planned to tackle this huge health challenge head-on, aiming for quick, real results.
Absolutely. And if you step back and look at the bigger picture, this campaign, it's not just about cutting TB cases and deaths. It's a really powerful demonstration of how a nation can mobilize everyone across all levels, from top ministries down to individual community members, to fight a deeply rooted health problem with intense, focused, time-bound energy. It really shows the power of coordination and a shared mission.
So what does this all mean for you listening in? It means getting a glimpse into the sheer complexity, the coordination needed for these massive public health drives, and seeing how vital those holistic, community-based approaches are. It really highlights that solving big problems often takes, well, everyone pitching in.
Right. This intense 100-day push is meant to make a significant, measurable dent in India's TB burden. That's the immediate goal. But it also makes you think, doesn't it? It raises a bigger question for all of us. What other big societal challenges beyond health even could really benefit from this kind of approach? This meticulous planning, time-bound focus, deeply integrated, whole-of-society effort, where every citizen feels empowered to be part of the solution.
That's definitely something to ponder. The potential impact of such focused multi-sector efforts on complex problems. Thank you for joining us on this deep dive.